All right, so another video for Northwestern hair restoration. We're going to talk about oral minoxidil, specifically, but minoxidil in general. Okay, so here we go. You know, as a hair restoration center that's considered to be the best in Chicago, a lot of people come to us for professional opinions. And recently, the New York Times published an article on oral minoxidil, which is a very cheap treatment for blood pressure that can also be used for hair loss. In fact, if you go look at what the generic ingredient Rogaine is, you'll see that it's minoxidil, so it's actually used topically. But we're talking about the oral form. And this gained a lot of interest because this oral form is just as effective as the topical, but it costs a lot less because it's not branded as a company. So you can go to your primary care doctor and you can get on this medication, or you can go to a hair restoration doctor and get medication. But there are some consequences to this. Number one, it's a blood pressure medication, which means you can drop your blood pressure. I will say that it's not a great blood pressure medication, so it won't drop it too far. If you ever had lightheadedness when you stand up or your blood pressure is low, I would really stay away from it. And that's why it's really hard for a hair restoration surgeon to prescribe this, even though we know how to use it and we know that it's good. We don't have the ability to monitor your blood pressure. It's something that has to be done by your primary care physician, but that primary care physician doesn't know much about hair loss, and it creates this interesting thing where it becomes hard to prescribe. So even though it's cheap and it's been around, that's why even seeing hair loss doctors will use it, especially since the topical form of Rogaine works very well. Now, what's the caveat? And I would say that the caveat is women with hair loss that have a hard time using Rogaine. It's sometimes hard to get to the scalp. Sometimes the hairs are thin, so the Rogaine foam or the oil can actually impact like your hairstyle. It doesn't feel that great. So in that case, we go to an oral minoxidil. But we can't use oral minoxidil when they're pregnant or planning to be pregnant, because it can actually have an impact on the fetus. So there is a very restricted focus for this drug. And I think the New York Times article really didn't present the whole story. They really did say, hey, this drug works, and it very well does, and it's cheap, and it's very well true. But you really need to see a hair loss professional that's willing to prescribe minoxidil before you even consider going on it. I have patients on it all the time, but I tell you who I use it for. I use it for women who have hair loss, who can't use Rogaine topically, and are not family planning.